Hello and welcome to the Greeley Healthcare Podcast, a recurring update the healthcare community addressing trends and topics of interest related to regulatory accreditation, medical staff leadership and credentialing, peer review, and physician alignment, the specialties of the Greeley Company. So please remember to subscribe to this channel and visit our blog featuring topical posts and webinars. You can reach us at Greeley.com. That's Greeley.com. And now to the brief subject of this update. The Joint Commission, we are getting questions from our clients who have had recent surveys, and there's going to be follow-up activity as related to the survey, and now the Joint Commission has suspended all of its survey activities. What does that mean? Well, we've been in conversation with Mark Pelletier, who is the Chief Executive Officer of the Joint Commission and the Chief Nurse Executive for the Joint Commission. And Mark is a great guy, has been assuring us and attempting to reassure you that the deadlines that were established prior to the suspension of survey activities are going to be extended. So to when, we don't know. It depends on how long the social distancing effort mandated by the CDC is in place. Could be a couple weeks, it could be longer. But for right now, if you have evidence of standards compliance, if they're ready to turn in and you can turn them in, please do, but don't be bound by deadlines for that, or if you're expecting a 45-day revisit because you had a Medicare condition level finding, that revisit date has been extended. Now, for specific answers to your specific situation, you should reach out to your account executives. Joint Commission website, which for those of you who are looking this on video, is up on the screen here, has some messages from Dr. Chasen in particular about their posture and their support for their customers, their accredited hospital. And so in here, there are a lot of resources and FAQs. Also, there is a video message from Dr. Chasen. I think it's worth a look. So that's our brief update for today. In upcoming days, we're going to be talking about telemedicine. We're going to be talking about potential ways to extend PPE based on and how you would go about doing that based on CDC and other recommendations, about risk assessments for the reuse of respiratory medications, and a lot of other topics that to help us cope as an industry with the coronavirus pandemic. But this podcast and this vlog is going to go way beyond that and touch on, like we said before, everything from credentialing, disaster privileges or regular privileging, OPPE, FPPE, physician peer review and leadership and physician alignment, and all the other areas that are within Greeley's sweet spot. So please subscribe, like we said before. We will do our best to keep you informed of everything we learn that we think would be of interest to you. Thanks again. Be safe. Talk to you soon.